Health Minister Dr. Joe Phaahla says being a nurse remains a noble and important profession in our country. Phaahla joined thousands of medical professionals at the Hani Baragwanath Academic Hospital to mark International Nurses Day. The day is meant to celebrate nurses' selfless service and dedication. Zola Sholwana reports.
A day that is observed every year to mark contributions that nurses make in the world as backbones of the healthcare system. The day is aimed at reshaping perceptions of nursing and how the profession's working conditions could be improved.
This is a very important day for us in the health sector, as is the International Nurses Day, because it's a day on which we pay homage to really our frontline healthcare providers overall, but specifically today being the nurses. Now, the nurses are indeed the backbone of provision of health services at the facility level, from the bottom in the basic, whether you talk about mobile clinics, whether you talk about smaller clinics, big ones, whether you talk about the most specialized, operations and so on. You can have your doctors, you can have your pharmacists and physio. If you don't have the nurses properly trained in those areas, you can never succeed.
The Democratic Nursing Organization of South Africa is calling on government to address challenges facing the profession.
One of the long challenges that has always existed, which worries us as an organization, is the shortage of staff. But now we take it further to say the shortage of skilled nurses, nurse specialists. And we can attribute this to the change in curriculum of the nursing profession. And that is why when we spoke here, the President emphasized the fact that what government needs to do is to be intentional as far as investing funds and also ensuring that the curriculum of the nursing profession speaks to the challenges, the health needs of the country.
In response, Dr. Joe Phaahla says the department does not have the budget to employ more nurses.
The shortage is there, not because we don't have the people in some cases. There are some specialities. If we look at, for instance, in ICU, theater nursing, some of the orthopedics, they mentioned here pediatric nursing. There are some specialties in which we're not training enough. But in the general professional nursing, nursing assistants and so on, we don't necessarily have shortage of the human resource, but it's our financial ability to be able to employ them.
Gauteng MEC of Health and Wellness says they are in the process of implementing a number of interventions to increase resources and capacitate various hospitals across Gauteng.
Bara is one of those. Dr. George Mukari, then Newzroom Afrika was sorted, and then Charlotte Maxeke, it's not bad like any others, but even the district and regional hospitals, there are specific areas where we need specialized nurses. Then that's where we'll have a problem, especially in the PEDS units. And why we know that it's in the PEDS unit, we have meetings with clinical managers and directors and the HODs. So there is a group that we have formed now in our hospitals that Professor Velapi is leading, that who is a doctor by profession. And he is able now to tell us which hospital. Tembisa is one of those two. So we have a sequence and lines of where can we beef up those teams based on the research that we are doing on our own.
The department is working on measures to make the profession more attractive to young people, to reduce the burden on the existing healthcare workers and avoid compromising the quality of patient care. For Newzroom Afrika on Channel 405, I am Zola Sholwana at Hani Baragwanath Academic Hospital in Soweto.